Leading things off, the deadline for open enrollment for health insurance is less than a week away. And our first guest joins us with information. We are pleased to welcome Errol Pierre, the Vice President of Product Management for Healthfirst. Welcome to the show.
Thanks for having me.
You're no stranger to the show. We see you out in the community all
Absolutely.
the time. And tell us, first of all, about the Affordable Care Act.
Sure. So there's been a lot of news around it. The Congress was thinking of repealing and replacing it. Luckily, as of today, it's still the law of the land, so it's still in effect. People shouldn't fear that they're going to lose their health insurance. They should still act on it. And the biggest issue right now is making sure you're enrolled. So the deadline for January 1st coverage is December 15th.
But the Affordable Care Act is still wrapped up within the new tax plan that they're trying
That's
to
true.
pass.
That's true. So the House and the Senate just passed a tax bill. There's a provision in there that requires people to get insurance, and if they don't purchase insurance, they face a penalty. That is being removed away. So that technically, if that passes and the president signs it, people wouldn't be required to purchase insurance, but it would still be offered. The Affordable Care Act would still be offered.
All right, so here we are. The deadline is here.
This week.
Yeah.
Got to act by Friday. Yes. So, there's a lot of people that are confused about what to do. Some of it is immigration status. They don't want to put their information in the computer because they think, who's going to use that information for, homeland security.
But that information is safe.
That's correct. It cannot be used for purposes of deportation. I think the other piece is income. If you make above about $25,000 a year, or that's roughly like $10 an hour, you have to enroll by 12/15, or else you won't have coverage January 1st. And if you make a little bit below, I would still go to the website. For the Bronx, it's newyorkstateofhealth.ny.gov. And that's where they can go in and check their eligibility.
What can you do if you miss the deadline?
Yeah, so the good news is if you miss the 12/15 deadline, which no one should, everyone should go get enrolled, you can still enroll for February because the open enrollment ends January 31st. So if you missed the 12/15 deadline, you still have time, but don't wait that long. Just go and get enrolled.
You should get on it right away, right?
Absolutely.
I mean, now.
Absolutely. And we have people to help. So we have people all over the community that can help you enroll.
Yeah. There are a number of places you can go to, but Healthfirst is where
Absolutely.
you work.
Yeah. So in the Bronx, we have a spot on East Fordham Road. We have a spot on East Tremont Road. So we can enroll you. You can come to us. You can just stop in. You don't need an appointment. We can do it in Spanish, in Bengali, Haitian Creole, English, whatever you speak.
Whatever you speak,
we can help you
get
enroll.
it done.
Absolutely. Absolutely.
Now, what's different this year as opposed to last
Yeah, so
year?
every year, the plans change. Deductibles go up. Deductible is what you have to pay up front before you get coverage. Copays change. So one of the big changes this year is that deductibles and copays increased slightly. So it's a little bit more money to see your doctor. But the good news is preventive care is covered at 100%.
You're still covered.
Absolutely.
It's a little bit more, but it's an investment in you.
Correct.
You
Correct.
You need to take care of you
first.
Yeah.
And the good news, so your annual physical, or if you're a woman and you want to go to your OBGYN, if you have a child and you want to get immunizations, those are covered free.
Yeah.
So preventive care is covered free. Everyone should get their flu shot, things like that. That's all part of preventive
What about
care.
pre-existing?
Pre-existing conditions, that cannot preclude you from getting insurance. So if you have diabetes and you enroll, we still cover your diabetic care and things like that. That does not stop coverage from you from getting coverage, which is good news.
Got to take care of yourself. Got to take care of you.
Absolutely.
What do we say? Health first?
Health first. You got to put your health first. Definitely.
Health first, and then you can begin to take care of everybody else. What should people know?
The one thing I would say is people who have coverage right now, they should see their doctor. If you have prescription drugs, go to the CVS, go to the pharmacy, fill them out. Just use your coverage while you have it now. If you have a primary care physician, one of the things we're trying to do is change people's perception of health. Right now, people only think about health when they're sick. They don't think about it when they're healthy. Even if you don't feel sick, you should still see your doctor once a year.
Get some screenings.
Absolutely. Cancer screenings, see if you have your sugar levels, check to know how your numbers are, see how healthy you are. It's always good to go.
Is there a certain amount that covers you, and then it stops at the end of the year and it picks up again at the beginning of the year?
Yeah, so that's how the deductibles are, which is always confusing. So like we have people who they might have a deductible that's $1,000. It resets on December 31st.
Got it.
So if I'm you and you've already hit your deductible, use everything you can. Before the year restarts.
Go to doc, get everything tested.
Yep.
Go get the colonoscopies,
Bring your
everything
kids.
that you can.
Yeah, everything. The other thing is doctors. So you might ask your doctor, do you accept Healthfirst? And they may say yes. The best way to check is on our website. Go to healthfirst.org, put your doctor's name in, and just make sure that they accept our coverage. as
Errol,
well.
are there any secrets or tips to registration or anything like that?
You know,
Anything that-
I've had people say it's a little difficult. I would say let us help you. That's our job. So we help anyone enroll. You can come to our site, Fordham
Don't
Road.
go at it alone.
Exactly. If you can get free help, and we'll assist you, we'll do it on the computer for you. We can do it in different languages. Just let us help you through the questions, because some of the questions are confusing.
Now, can they go on at home from
They
by
can,
computer?
absolutely. They can even start the application. If they get stuck, they can call us, and we'll help them where they got
Yeah.
stuck too.
Or print it out and take it down to
Yeah,
the location?
Absolutely. Because sometimes they ask questions about your income and your immigration status, and that sometimes gets people confused. But we can help you through.
And these are, who's eligible for the
Yeah,
Affordable
so
Care Act?
the Affordable Care Act is actually includes everybody. So there's people who are eligible for Medicaid, they're getting coverage. There's people eligible for a product called Essential Plan, that's for new immigrants to the country. They've been here less than 5 years, and it's also for people who make a little bit above Medicaid. And then you have the people called Obamacare plans. That's for people who make over $25,000 a year. Everyone can enroll through the Affordable Care Act for these products. So what we say is just go in, put in your information, and we'll determine what's the best product for you.
Yeah. And they can go to any one of those places. You mentioned a number of locations where people can go if they have a situation. Or if they
Yes.
just want to walk in and sign up.
We take all walk-ins, and we have 2 spots in the Bronx. We're all over the city. We have spots in Manhattan and Brooklyn, all over the place. So if you see us, if you see anyone with a Healthfirst logo on their shirt, ask them a question.
There you go.
You can see us in hospitals and pharmacies and things like that.
I like you guys. You're always out in the community. You're doing health fairs. I was out there with George, and we give these free healthcare screenings, and we find people who are
Yes.
on the verge of dying.
Yes,
believe
yes.
it or not, and we send them to the emergency
Absolutely.
room.
Yeah, I
That
we
has
did,
happened on a few occasions.
absolutely. I know we do the one in Harlem.
Yeah.
And I know you hosted.
On the
and-
state office building, at the state office. Yeah.
Yeah, exactly. And people find out, through their screening that their blood pressure is so high, they had no
Yeah.
idea where it was. And
Or they're getting ready to have a stroke or something like that. We send them straight
Absolutely.
to the emergency room.
Absolutely.
So this is great.
I think if you have a New Year's resolution, it should be make sure you have a primary care physician.
There
That's
you
the one thing you can do.
go. Where do we go for more information?
Healthfirst.org is our website. So you can come to us, you can get our phone number, or you can call us at 1-855-275-4301. You can call us to book an appointment. You can actually enroll on the phone.
Yeah.
So if you don't want to leave your home, say it's snowing outside, do your enrollment over the phone. We can do it over the phone. You can come to our site. We're right in the middle of Fordham Road, right by the train station, Fordham Plaza. So we are in the Bronx, wherever you need to be. There's like 2.3 million people in the Bronx. No one should be uninsured. Everyone should have coverage.
Healthfirst.org.
Healthfirst.org.
Give them a big round of applause, everybody. Vice President of Product Management, Healthfirst, Errol Pierre.
Thank you so much.
Thank you so much.
Yeah,
All
I
right.
appreciate it.
Stick around for a little while, okay?
Of course.
We're going to take a quick break right here, but stay tuned. I promise we'll be right back.